Hey, what's up guys? Today we're going to be talking about hip fracture. So a hip fracture is a fracture of your femur's upper third. So fractures within the hip joint are called intracapsular fractures. These fractures are often associated with osteoporosis and minor trauma. Sometimes they call them fragility fractures. And women over 65 years of age experience hip fractures at a higher rate than men due to the prevalence of osteoporosis. In fractures that occur outside the joint capsule are called extracapsular fractures. These fractures are often associated with several direct trauma or fall. Now, what are the clinical manifestations if you suspect a hip fracture? You should see external rotation, muscle spasm, shortening of the affected leg, severe pain, and tenderness around the fracture site. So external rotation in hip fracture means that when the leg turns outward from the body's center line. And leg shortening occurs when the femur breaks and muscle around the hip joint contract, causing the fractured bone ends to overlap. This displacement makes the affected leg visibly shorter than the unaffected one. Now, one of the severe complications that can happen is when displaced femoral neck fractures interrupt blood flow to the femoral head, which may lead to avascular necrosis, meaning the death of bone tissue due to lack of blood supply. Now, for nursing management, immediately immobilize the affected leg if you suspect a hip fracture. Buckstruction can be used to immobilize the hip fracture before surgery, and ultimately, surgery is the gold standard treatment for hip fracture. Now, let's just discuss briefly some of the types of surgeries they may perform for hip fractures. Sliding hip screw, also known as dynamic hip screw, is a hip surgery procedure to fix intertrochanteric fractures of the femur where the fractures occur just below the femoral neck. Now, the other type of hip fracture is the intramedullary nail. Intramedullary nail is a type of hip surgery procedure where a metal rod is inserted into the medullary canal of the femur to fix the fracture and is usually used when the patient has extracapsular fractures. In arthroplasty, arthroplasty is a type of hip surgery procedure where the damaged joint of the hip is replaced by prosthesis. Sometimes it's called joint replacement surgery. Now let's talk about some of the preoperative care before they go to surgery. Now, most of the patients with hip fractures are initially seen in the emergency department, so we typically prep the patient in the ED before they head to surgery. Things you can do include making sure the patient is NPO and documenting the last time they had water and food. Another important aspect of preoperative care is the importance of managing and controlling their pain while awaiting surgery. Also, majority of these patients are elderly, so they may have comorbidities like diabetes or atrial fibrillations, and they may currently be taking blood thinners, so you might need to consider that. Now, here are some of the post-op care interventions after the surgery. Monitor airway, breathing, and circulation. Check their vital signs frequently, monitor their fluid intake and output, assess their pain levels, and administer appropriate pain medication. Perform neurovascular assessment of the affected leg by checking color, temperature, capillary refill, distal pulses, edema, sensation, and motor function. Elevate their leg to decrease edema and don't put pillows on the seat, as this can cause internal rotation or force the hip to rotate inward. Use abduction wedge between legs to maintain proper hip positioning. Place straps above knee to prevent pressure on peroneal nerve at lateral tibial tubercle. And of course, educate the patient and family members to look for signs and symptoms of infection, bleeding, and how to manage pain at home. There are some complications associated with femoral neck fracture, and these include non-union when a broken bone fails to heal, avascular necrosis, dislocation, and osteoarthritis. Alright guys, that's it about hip fracture, and this will be part of your exam 3.